Assistant Director in Public Health here in the Public Health Division at Birmingham City Council. And I'm joined by my colleagues from the communities team here today. And welcome to all the people that have joined the webinar. So for the next hour, we're going to be talking about community health profiles and specifically about the community health profile that's just been completed on our Caribbean islands, Commonwealth countries. So really big warm welcome to everybody. I'm going to kick off with another welcome from our Cabinet Member, Councillor Mariam Khan. So Jordan, I can't hear the audio.
Out of how diverse.
There we go. We'll just
Hello,
reboot
everyone.
Councillor Mariam.
I'm Councillor Mariam Khan, the Cabinet Member for Health and Social Care. I'm delighted to see the launch of our community health profiles and so pleased to be welcoming you all. I am proud of how diverse Birmingham is and of how welcoming we are to people who choose to make this city their home. However, we know that not all of us experience the same levels of good health and well-being as each other, and that there are real differences between communities. In the Council, we take this seriously and see tackling these unfair differences in health as a core component of the work that we do. The community health profiles have identified and summarised the physical health, mental health, lifestyle, behavioural and wider determinants of health-related issues affecting communities both locally and nationally. The findings from these key public health documents will shape how we address, protect and prevent health inequalities in our city. We've always struggled with understanding the detail of some of these inequalities, and this is where our community health profiles come in. The Public Health Communities team have, in partnership, developed a series of evidence summaries that focus on helping improve our collective understanding of our diverse communities, the health and well-being challenges and key inequalities that they face. I hope that you find this session useful. We have the opportunity today to share our approach and findings with you and also to discuss this in more detail. And afterwards, we'll look towards how we can work together, not only for our respective communities, but for Birmingham as a whole. Thank you.
Right, so it's always good to know that we have our political leaders well and truly behind our work, and I know Councillor Khan is really welcoming of the community health profiles. So let's move on to the next slide. So we'll start with just a little bit of housekeeping. We're going to encourage people to keep their microphones off during the webinar, to keep background noise down. And if people are struggling with bandwidth, we find it often helps to turn off a VPN if you've got one running. And please, if you've got any questions or comments or things that need clarifying, please pop a question into the chat. If we don't get to them all during the webinar, we'll do an FAQ afterwards. Or you can put your hand up if you prefer, but we'll pop them in the chat, whichever's easiest. The webinar will be recorded and it will go on our website as another one of the suite of resources that sit alongside the community health profile. So if you have to dip out for any reason, or you've got colleagues that have missed out this afternoon, then they can listen in when it's put up on the website. And really encourage you to introduce yourselves to each other using the chat function as well. So if you can just pop your name and your job title and the organisation that you're representing here today, we'd really love to know who's on the call with us. It's always really nice to know who you're talking to, isn't it? Let's move on to the next slide. We're also going to be using Menti this afternoon. So Menti is an app that you can download onto your phone. You can use the QR code here to get to it if you don't have it already, or go to your app store or menti.com. And then when you get into Menti, you'll need to enter an 8-digit code to get to the work for this particular webinar. And the code for the session today is 86873458. We'll be reminding you of that later on if you've missed out, but you've got a few minutes now to download Menti so that you're ready when you get to that part of the session today. So today we're here to talk about community health profiles, and community health profiles are part of a suite of public health evidence reports that we've been working on within the public health team here in the council. We feel that a really important part of our role is to bring together the knowledge and evidence around particular populations across Birmingham, and this community health profiles are part of that programme of work of evidence reports, because we think that making decisions to address inequalities in Birmingham are best done if they're based on evidence and information, and we really hope that the evidence reports that we're producing are informing people to help them make better decisions. That's the point of them. Some of these evidence reports we have to do them by law, and they include the Joint Strategic Needs Assessment, again published on our website, which is a regularly refreshed snapshot looking at the overarching health and wellbeing issues that face citizens of Birmingham, and also looking at some of the factors that underpin health, and looking at health inequalities, of course, because they're such an unfortunate feature of health and wellbeing in our city, and they draw together data from across the council and other parts of the public sector. And then Justin Varney, who's our Director of Public Health, publishes an independent report each year on issues that he feels he wants to highlight, and that's our annual Director of Public Health report. So they're statutory functions. But we also have other products that we work on, which we choose to do because we think they add value to decision making. So we have a series of deep dive needs assessments looking to see where there's capacity to benefit between particular populations, and they're often very detailed pieces of work looking together to make recommendations around particular services or approaches. And then we have a series of topic-based commissions, which is a new evolving methodology where we collate evidence with active community collaboration to look at creating some evidence-based solutions. And then the profiles that we're here to talk about today, the community health profiles, are slightly different in that they are a collation of desktop. There's a desktop analysis to look at the published literature out there that's then collated into the community health profile alongside grey literature and population survey data. And the idea is that they provide a snapshot of inequalities around a particular population. So everything we do around health and wellbeing in Birmingham is governed by our health and wellbeing strategy. And the health and wellbeing strategy is aiming for a bolder, healthier city where every citizen can enjoy a healthy and enjoyable life. And the idea is that the community health profiles help us understand the gaps and the health inequalities in achieving that ambition between different communities. So the communities that the profiles centre on are communities that are bonded either by a sense of identity or interest or experience. And they set out differences in need so that this evidence can help the council and its partners and communities to design interventions and programmes to take action to close those gaps to improve the health and wellbeing of people in Birmingham. Community health profiles are intended as a public resource, so they're not, we don't want them to sort of sit on a virtual shelf somewhere. We really want them to be used. So they're published on the council's website as resources so that they can help whoever needs them out there. So if people want to use them to inform bids or programme development, that's great. We just want them to be out there, people to use them, and hopefully save people some work in having to pull together the evidence themselves, because we've done it and it's all in one place. Now, as soon as you publish something, it's out of date, isn't it, the minute you put it into print? So we recognise that these are going to need refreshing. The idea is that we'll refresh them sort of every 5 to 8 years, as a lot of the information won't change in that time period. But if a new piece of evidence or new data becomes available, then of course we'll look at doing that more often. So something that's coming over the horizon, of course, is the publication of the 2021 census data, and we'll be having a really good look at that to work out how best we incorporate that into the community health profiles to keep them as up to date as we can in the meantime. This slide looks at all the evidence reports, the whole programme, so you can get an idea of the topics within each element of the evidence reports programme. And the pink box on the left is around the community health profiles. So you can see there's a whole range of communities there that we've looked at. And some of these things we've done internally, and some of them we've commissioned out through external partners. And the one in bold there is the one we're looking at today, Caribbean Islands, Cornwall States communities. And then you'll see the topics there for the deep dive reports and the two commissions that are running at the moment, the Birmingham Poverty Truth Commission, where at the moment we're looking a lot at housing in that commission, and the Birmingham and Lewisham African and Caribbean Health and Equalities Review, Black Year, also recently published and available online as well. So community health profiles don't just look at physical health and well-being, they also look at mental health and the determinants of health around healthy behaviours, and also those wider social and economic factors that we know make a real impact on people's health and well-being. And the idea is, excuse me a minute, really noisy in this room. So to collect and present that information using those 10 key priority areas that are in the health and wellbeing strategy. So we try and structure it around the topics there. And then this is the beginning of the promotion of those community health profiles, and also the beginning of our engagement with local communities on what's in the health profiles, so that in the engagement work that follows, we look to highlight opportunities, to find opportunities that will address those inequalities. So the reports are structured around the themes in the health and wellbeing strategy, and you'll see them listed here. So they go right the way through the life course, starting with best start in life, and of course working towards ageing and dying well. And then there are 3 sections at the end, specifically looking at closing the gaps around health inequalities, about green and sustainability issues, because we know this is such an important long-term determinant for health and wellbeing. And also mitigating the legacy of COVID-19, which shone such a harsh light on health inequalities in our city. So the methodology for the community health profiles is based on a literature review. So the idea is that the information in them is robust and reliable. So it's a comprehensive review of the academic literature using recognised search engines alongside population data, but also includes grey literature. So looking at information from voluntary sector, community reports, and government agencies as well. And where it makes sense to do so, we've used comparison groups. So we might use a comparison between data around Black Caribbean populations and compare that to Black other or white British groups or white groups, where it helps us tell the story around inequalities. Clearly, this is a collation of the published evidence that's out there. So if the evidence and publications aren't there, then they can't be included in the profile. So there are some limitations in the findings. I've already mentioned the census. So the census data that we're using at the moment is still from 2011, because we haven't got all the data out of the 2021 census yet. So there might well have been some changes, and we need to bear those in mind. This population that we're looking at today is a really diverse community, so from lots of different states. So it's really difficult to capture accurate data on people of Caribbean Commonwealth descent, because it's such a heterogeneous community. And the census data has been particularly difficult because children born in Britain of Caribbean parents, because your ethnicity is self-defined, they tend to identify themselves as Black British rather than Black Caribbean. So you will see during the profile, as we go through some of the results from the profile, that sometimes we've referred to data for people who've identified themselves as Black British as well as Black Caribbean. And there's very limited specific data available on smaller community groups. So, you know, we have to bear all that in mind as we're interpreting the findings of the profile. So as I said, the idea for the community health profiles is that they're publicly available. And there is a full written report. It's quite a lengthy report, and there's also a summary PowerPoint slide set. And the idea is that people want people to use this information, say where it came from, but if you want to cut and paste our infographics, please do. And they're published on the communities pages on the Birmingham City Council website. And there's also a highlights video and then this series of webinars as well. So I'm going to hand over now to my colleague, Ricky Bandal, who's going to talk us through some of the details of the findings in this particular community health profile. Thank you.
Thank you, Tessa, and welcome everybody on this afternoon to this profile. Before I start, obviously some of the language that's going to be used today is going to be quite emotive, and it might trigger some feelings or emotions. And so there is some contact details in our chat which will be on there if people need kind of further help and support. So the topic areas within these the profiles in general, and when people are linking through this, it might they might go to another profile. You know, it covers subject matters such as mental health, anxiety, depression, self-harm, homophobia, eating disorders, suicide. So it's just making sure that it's some of the content that's going to be discussed is quite emotive, but it's just re-emphasizing this is based on public literature that's been available to the best we can to adapt it to the city. Okay. Right, so we're just going to make, you'll probably hear me saying next slide, Jordan, quite a lot. So please familiarize yourself with that before we start. Okay, so in context of the overview of the community, we're just going to go into a quick definition. So one of the areas we did within here was looking at the timing of the event. This is one of our showcase profiles that was used during the Commonwealth Games, and for a lot of this information was coming from the census data, especially on this slide, which is 2011. Now we know the census data that we've just done in recently 2020 and 2021 with the spillage. We should be getting some of that data coming released towards the end of the year, or definitely towards the beginning of next year. When that does happen, we'll be updating the profile systematically, because a large, strong majority of the data in these profiles will still relatively stay the same. What will be different is around some of the population data that we've got within here. And some of the key statistics that have been showed within this slide shows roughly about 577,826 Black Caribbeans live in England and Wales. 8% of all Black Caribbean people in the UK live within Birmingham. So we know there's a strong cohort of the community based within this city, which is not surprising based on history. But also we know these emerging communities might be changing as well, as people might be leaving the city or getting bigger themselves. Jordan? So an overview of this profile highlighted the seven areas. One, which is around there was high prevalence of childhood obesity, low educational attainment, high rates of obesity amongst Black Caribbean women, lower proportions of Black Caribbean men in full-time employment. There's an increased risk of dementia and Alzheimer's disease, high prevalence of doctor-diagnosed diabetes, and low uptake of bowel cancer screening. That's really important at this bit within the profile. Whatever your organization that you're in here, or anything that you're campaigning for, there'll be a section of the profile in itself which will be relevant to you, and it's key statistical data that will be useful for you guys to move forward, and for us looking at what future engagement looks like. So starting off, the report that was done in 2014, which was around looking at ethnic variations in severe maternal morbidity, identified that severe maternal morbidity is 80% higher amongst Black Caribbean women compared to white women, and that Black Caribbeans have amongst the highest prevalence of childhood obesity of any other ethnic groups at 16.4% of 4 to 5-year-olds and 14.9% of 11 to 12-year-olds are overweight and obese. And that report was taken from the NHS Digital National Child Measurement Programme in England 2020 and 2021. But some of the reasonings that have come in, the barriers are identified in pregnancy and postnatal care. Came across as there was risk factors for late antenatal bookings, less likely to be referred for postnatal depression, high rates of stillbirths and infant mortality, and self-reported poor postnatal care. Jordan? In a report that had been done in in 2006, which was titled "Incidence of Schizophrenia and Other Psychosis in Ethnic Minority Groups." It was identified that the community are 5 to 12 times more likely to be treated for serious mental illness, such as schizophrenia and mania, compared to the white population. Linking it to substance misuse, a Home Office report around findings in the crime survey in 2013 to 2014 identified Black Caribbean men at 16.5% had much higher drug use than Black Caribbean women at 3.4%. Now, some of this data is all this in studies that be reported. This slide will be this slide set will be available and put up to on them over on our website. Jordan. In 2004, a health survey for England had been conducted and had identified that the prevalence of obesity is higher amongst Black Caribbean women at 64% than the general population at 57%. Now, there is a movement, and we've started it within public health in Birmingham around a food strategy, a food pledge. And so there are opportunities in terms of future engagement, looking at the community to kind of tackle some of the inequalities that have been identified. So it's always worth bearing in mind that a lot of the data is very uncomfortable even to say, but this is what the studies are showing at this point, and it's about how we move forward in terms of our engagement. Next one, Jordan. So in 2019, a report from the Department of Digital Culture and Media and Sport England identified that there was an increase in inactivity within Black ethnic group at 29% compared to white British group at 25%. Some of the barriers that had been identified, or some of the reasoning that had been identified, was that there was still high participation in physical activity. There was fewer differences in physical activity in under 15s, but there had been a recent decline in physical activity. Most important of all, there was limited data on the Caribbean population. Going back to the census data in 2011, regarding housing, Black Caribbeans have relatively high level of owner occupation housing at 45% compared to Black other population at 28%. Again, in a recent study in ethnicity facts and figures linking to employment and education, the community was identified as one of the lowest GCSE attainment at 29.2% of Black Caribbean boys, and 40.4% of Black Caribbean girls achieve GCSEs at grade 5 or above in English and maths. The last statistic that you can see there, the bullet point was taken from the Department of Education, and said that there was a substantial gender gap in Black Caribbeans progressing to higher university, the highest of any ethnic group, at 34.6% male and 54.6% female. So the women within the group are considerably more likely to have a degree. Now, the next few slides actually are being labeled, put together because it's following the health and well-being strategy what Tessa had started off. So the next few slides will be around protect and detect aging and dying well, and closing the gap and mitigating the legacy of COVID-19. Sorry. In a report that was done by the UK Health Security Agency in 2021, titled HIV Testing and New HIV Diagnosis, it identified that the number of HIV diagnoses made in heterosexual people declined by 40% in the Black Caribbean population. Regarding tuberculosis, in a report that was done by the UK Health Security Agency called Tuberculosis in England, a 2021 report, identified that non-UK born Black Caribbeans had a higher rate of TB cases, 63 cases, than UK born Black Caribbeans at 46 cases. Next section around aging and dying well. So I'll just jump to the kind of leading the causes of death. So in a report that had been done for the Office of National Statistics, which looked into the ethnic differences in life expectancy and mortality from selected causes in England and Wales, identified that the incidence of dementia was 25% higher in Black Caribbean men and women compared to the white group. And the last part of that report also identified from 2012 to 2014, cancer and circulatory diseases made up 64.7% of male and 65.4% of female deaths in the Black Caribbean group. Some of the causes of death have been identified around dementia and Alzheimer's disease, ischemic heart disease, malignant neoplasm of the prostate. So prostate cancer was very strong through the data, and cerebral vascular disease. So closing the gaps and mitigating the legacy of COVID-19. Now, this is an area that is been so recently, a lot of data is coming out post-pandemic. We will see a lot of information coming out to help support and expand on some of the data that's been identified. Some of the key statistics around this, I'll just go into COVID-19 section here, was based around a UK HSA COVID-19 report that was done in February earlier this year, which identified the initial vaccine uptake was lowest among the Black Caribbean population. And then another report that had been done later on, a month later, identified of the hospitalized patients of COVID-19, Black Caribbeans may be at the increased risk of death. Now, just to take a pause at this second, there's a lot of information that I've gone through in terms of some of the statistics over the last 15 minutes. What we've managed to do, again, like with the other profiles, is put them succinctly into infographics for it to be used. So we've created three infographics for you to have a look at, which go through the health and well-being strategy, the themes that have been identified. So on the first one is looking at an overall context in terms of what the situation is within Birmingham, looking at the population from a religious context. It then looks at we added the COVID section at this part, and a newer section around green and sustainable future at the bottom. So there are sections which go in greater detail in the actual profile itself. I would suggest strongly that the people who are got a keen interest is to look at the document at a whole first. It is a superb document with real great details. I mean, all the profiles are, to be honest. Next one, Jordan. Now you can start seeing it more clearly in terms of the themes involved. So the mental health and wellness, healthy and affordable food, and looking at the sort of obesity rates clearly identified in the middle of your screen there. About cooking, some of the looking at the use of salt within cooking as well, being very high, getting the best start in life, and then looking at it being active at every age and ability. The final infographic is looking at working and learning well, protect and detect, aging and dying well, and some of those areas of closing the gaps around life expectancy within the population. So gonna look at what the next steps are. So with the 16 profiles that we have identified, we've also done another set of big reports around creating a healthier faith-based toolkits to be implemented, and we're going to be having another 12 profiles undertaken in this year. In this kind of working year. What we've done for the initial phase 1 of the 16 profiles and the faith toolkits is we're looking to commission organisations to work with to help put and cascade some of this information out into communities, then being able to provide support into initiatives to try and tackle some of those inequalities. Also then is looking at case studies where some of the healthier based faith toolkits are being implemented across the city, not just concentrated in one area, but to have a Pan Birmingham approach, and then building up the engagement pathway, because we know these inequalities have been identified here are decades of work that's happened and caused these inequalities. So we know that it's not going to be something we can kind of tackle in the next 24 hours. However, we are starting that journey together, and these profiles provide a strong foundation for us to kind of work and commission off, and most importantly, to help enable and empower the communities who have been identified to try and see any piece of work that they want to do. They've got a supporting document right there. Tessa, I'm going to pass it back over to you at this point.
Thanks, Ricky. So a really good summary there of some of the key messages, and there are lots and lots of key messages in this particular health profile, some really distinct inequalities that have become apparent in the work. But now we're wanting to pick your brains a bit as our group of people that have come together to listen to the webinar, and we're going to do that using Mentimeter. So if you load up Menti on your phones, then you can participate in the next bit of the session. So just a reminder for people there, you can use the QR code, or you can go to menti.com if you don't have it already. And then when it loads onto your phone, you need to add the code 86873458, and then you should have on your screen the Caribbean Commonwealth Community Health Profile launch event page, which is what I've got on mine. Okay, so let's move on to our first question on Menti here. So first question is, how are you feeling today? Let's use the little slidey scale, and you can move it along and see how you're going. See how people are scoring this afternoon. Oh, we've seen quite a happy bunch. It seems to get happier as the day goes on. I don't know if that's all because we all love our jobs so much. The ones that we've done first thing in the morning have definitely scored lower. Oh, coming down now. Okay. So you can see bottom right hand corner, I can see that 9 people have responded. Any more for any more? Okay, so we've got a few more people joining. That's great. So we seem to be settling around 7.4. That's not bad at all, is it? See how we're feeling. So definitely at the energized end of the scale, which is brilliant. Let's move on to the next one. So this one's got a bit of a disclaimer. We're going to be asking you for some personal information about yourselves. There's absolutely no pressure to answer. If you don't feel comfortable at answering, please don't. But it would help us to understand a bit more about the people that we're reaching through these webinars. So move on to the next one. So first of all, how old are you? People are ahead of the game already. Look, loads of answers up there. So we've got a bit of a spread there amongst the working age population. A little bit of a cluster in our younger adults there. Well, young compared to me anyway, 25 to 34-year-olds. Brilliant, so quite a good spread. That's excellent, thank you. And how would you define your ethnicity? Thank you for sharing. People have been great, haven't they? Really open about sharing information about themselves. So thank you, and a reasonably good spread there. So that's good. Good to see. Okay, let's move on. And religion. And some people are discovering the comments function there, so you can always send a comment as well if you want to. And they'll pop up on the screen as well, so that's great. Thank you. Move on. Fantastic. So the next question is, do you consider yourself to have a disability? Thank you. Let's move on. And the first part of your postcode. So whereabouts are you now while you're listening in? So this one doesn't come up with an answer, so I'll just sit and wait until we get a few more people responding. Hey, thank you. That's great. Move on. So now we're starting to pick your brains to find out how you or your organisation would be able to cascade this information into the Caribbean community and with key stakeholders. And we really need to make sure that this information is shared and gets out there. Got some really good ideas coming up already. Any new ideas would be fantastic. We've got some ideas there about discussions with stakeholders and working with the community, as well as moving through our organisational structures through HR and management. Yeah, and looking at events would be a really good way to reach people as well. We're starting to get some other ideas come through here. Brilliant, some great ideas, thank you. Yeah, so I think our staff as well, a really important client group, aren't they, here for us in terms of getting this information out there. If we share it with the staff, we can make sure that it gets used, which is what we want. Brilliant. Okay, so what opportunities do you have to embed the key findings? So the stuff that Ricky's run through with us, the key findings of the profiles in your line of work. There's some great opportunities that people have, hopefully, to use this information. It's interesting. I think that I really like the comment about feeling empowered to talk about these issues. I think when you've got the published information collated in one place, it just makes you feel really confident that to raise the issues, doesn't it? You've got some evidence to back you up in your conversations, which I think hopefully this will provide. Yeah, so some work about embedding the information in contracting, which is brilliant in different age groups, and through networking through all sorts of different fora, so which is exciting. So thank you for that. Let's move on to the next one. So now we get to rank an issue. So you get to choose which of the issues you think is most important. From the blue one about the low employment rates amongst Black Caribbean men, about the high prevalence of childhood obesity, low academic attainment at A level, the obesity rates in Black Caribbean women, and high rates of dementia and mortality from dementia and Alzheimer's disease. So which of those do you think is the most important health inequality for the Caribbean community to focus on? Any more votes for that one? They're coming in. It seems fairly consistent, the picture so far. Oh, having said that, they're all jumping around now. People obviously thinking carefully about this one. It's interesting, isn't it, that the determinants of health seem to come up really highly in a lot of the discussions we're having about the community health profiles, and the blue block, the low employment rates amongst Black Caribbean men, is that key determinant. Yeah, and we say they can't prioritise. I think this is a tough choice. They're all really important, aren't they, to different people in different walks of life. Yeah, and people in this group are saying that employment rates are one of the things that they want to focus on, but they're all important, aren't they? They've all got votes here. Yeah, so number 1 was employment, number 2, childhood obesity, and number 3, academic attainment. Interesting. Okay, let's move on to the next one. This is about looking to the future, about what we do with these profiles next. So you've heard that we have ambitions to do more engagement around the profiles to make sure that people know they're there and understand how they can best be used, and also to think about how we can use the information in them to try and generate some solutions to the health inequalities that this population experiences. So what should future engagement of the Caribbean profile look like? Looking for ideas here. You guys are going to have good ideas on this, I know it. Yeah, so talking to the actual community themselves, hearing what they think, absolutely crucial. This is brilliant. We're getting some really good ideas here, and a really strong theme of actually listening to the community to generate solutions and empowering them to develop those solutions and put them into place within their own community, which I think makes a lot of sense. And there's been some comments in the chat, haven't there, about listening to lived experience and anecdotes and people's stories. And I think alongside this published information, to have those stories and anecdotes is a really powerful combination for change. And talking to our younger residents, so not just sticking with a particular age group, but that's a really important point. Some really good and rich ideas there. Thank you. They'll be really useful. Okay, moving on. So I said earlier on that, you know, for me, the worst thing that could happen is that this sits on a virtual shelf and no one ever looks at it and all that work goes to waste. But I'm really interested to see what you think, how we should measure the success of this particular community health profile. How will we know that it's been worth doing, that it's actually been a useful exercise? I'm not sure if people's brains are frozen or if if Menti's frozen. It's really hard to tell. We've got a couple of ideas about the fact that it's quoted, which is good, and that there's a focus about shifting culture. Any other ideas on how we will know if this profile's been a success? So having a shorter timescale for review, and organisations that are really engaged in these priorities, providing evaluation and feedback. And really important that we listen to the customers in this for this profile. Absolutely agree with that one. Yep. And a longer term view as well. Yeah. And I guess what we're really looking for is that change, aren't we? That reduction in health inequalities in the long term, which has come up there too. Great ideas. Thank you. It's helpful. Okay. So at the beginning, I think we were 7.8, we said, or 7.2, I can't quite remember. I didn't write it down this time, about how we felt. But how do you feel towards the end of this workshop? How would you rate that you feel? Are you feeling in a low mood, or are you feeling really energized? Give yourself a score out of 10. Well, that's not bad, is it? So we're definitely more energized than we were half an hour ago. So that's a good thing, I think. And especially, 7.7 dropped down a little bit, but still a little bit higher than we were. So that's good. Not bad for the time in the afternoon when we're probably at our lowest energy. So that's pretty good going. Thank you, everybody. That's brilliant. Let's move on. So we've been running a series of these community health profile launch events this week. You'll see the ones that we've covered there. The profiles and the webinars, the profiles are already up on the website, and the webinars will be loaded really soon. So you can, for people who've missed the actual webinar, they'll have an opportunity to watch it online there. And then we also have other profiles that are in development at the moment. So this programme continues. And I don't know, Ricky, if you wanted to say a bit more about the engagement partners.
Yeah, so we are going through a process where some of the partners have been named, or just going through the final stage of what engagement looks like. And then we should have an idea in terms of what the sort of the next 6 to 12 months of engagement looks like. And then at the end of that, we will have an evaluation process around what's been effective, what's working. So that's kind of completes phase 1. However, we have started phase 2, is looking at the other kind of communities that have been identified as well. So it is a learning experience. We're not saying it's 100% perfect. We will be tweaking things as we're going along, and we're very open and transparent about that as well. So it's a big credit to Bayswater who did this who got commissioned to do this piece of work, and then for the team in order to bring it all together as well. So it's a massive task that hasn't been done before, locally or nationally. It has been getting a lot of attention. And hopefully that we sort of continue that pathway. It also is an opportunity for other councils, other public health, for example, to kind of join up and look at our methodology and the way that we're doing it, because as you know, with Birmingham, we would have some of our partner councils some of the data here will be really useful for those as well.
Thank you, Ricky. That's brilliant. Okay, so I'm not seeing any burning questions in the chat, so I'm hoping that the presentations and the run through of the profiles has whetted your appetite to go and read the document and look up the resources online. I really hope that you find them useful. Again, big thank you to our partners at Bayswater for actually writing the profile, and a big thank you to the communities team for the commissioning of that and oversight of the project, and for producing the webinar today. They've done a great job. We've got a question about which section of the website can the slides be found. We'll be uploading those soon. I'm not quite sure when they're going up on the website. Ricky, do you know?
They'll be done within 20. It takes 24, 48 hours sometimes for it to upload it onto the website. So, but it's sooner rather than later. The profile is already live on there, and it might be a good point to put this. So Reesa just put the link in. What we're looking to do is if we can take the sections out of the infographics and have them as separate pieces, because I know people will be needing them in PowerPoints or whatever they want to do, they can do that. In some cases where we're able to translate some of the profile in itself, we will. If, for example, we're able to translate an oral version of the YouTube, of maybe of this, or of just the infographics, that will be done as well. So we're looking at the best ways of engagement that we can do. We're also working with the communities in order to do that. But in some cases, for example, where we looked at the Nigerian profile, there's something like 521 different dialects and things that have been identified. So we've got to kind of find out which versions that we're able to translate as well.
Yeah, that's good point, Ricky. Yeah, so And yeah, really looking forward to working with the partners that we're new partners that have come online today and people that we've worked with for some time to move forward on these, because this is the beginning of the process, the collation of the written evidence. And the next stage is around trying to translate that into action to lessen some of the health inequalities that we've evidenced through the profiles. So I think that's probably all we need to cover in the webinar this afternoon. Big thank you to the communities team for pulling this all together, and a big thank you to Bayswater for writing the profile, and a big thank you to you guys for taking time out of your busy days to join us this afternoon. We'll close there. Thanks a lot. Bye now.